Hi, I'm Dr. Allison Muller. I'm a toxicologist in the Philadelphia area, and I give a 1 hour continuing legal education talk to attorneys about the science of opioids to give them some pearls to help them with their opioid related cases. This video just goes over a couple key points of opioids. The first area of opioids that attorneys should be aware of is what opioids do and what the symptoms of opioid use or opioid overdose would be. So opioids cause central nervous system depression and in turn depress respiration. So what does that mean? What does that look like? So the person who is becoming toxic from opioids, and opioids are drugs such as oxycodone, hydrocodone, morphine, heroin, and some of these are technically opiates, like morphine, meaning they're naturally derived, but we'll use opioids as a catch-all term. So opioids will depress the central nervous system and make the person drowsy, slow with movement, maybe not responsive at all, and depresses the respiratory drive in the brain. And depending on the dose of the opioid, the tolerance of the user, and the actual drug itself, that'll depend on how quickly somebody is affected by the opioid in terms of, how long does it take for an opioid to depress someone's breathing and eventually lead to death should it be an overdose situation. And this varies. This varies from minutes to hours. So why does this vary? This is one of the biggest questions that I get from attorneys. Why is there not a set time frame for the use of an opioid, and if it's a death case, the ultimate fatality? And a lot of it has to do with, of course, the potency of the opioid, how strong is it, and what the dose is. But really that dose can vary from person to person, and that's because of the development of tolerance to opioids. So there's two types of people that are using opioids. Those are people who are opioid naive and opioid tolerant. So people who are opioid naive are not used to taking opioids. They're either brand new to taking opioids or they've had a period of time where they've had zero use. And somebody could have been using opioids for a long period of time and therefore be opioid tolerant, meaning they need higher and higher doses to get the same effect. But if they don't use for as little as a week, and that could certainly be longer for some people, there's quite a range in terms of how long it would take someone to lose their tolerance to opioids. Once somebody loses that tolerance and they come back into the opioid naive category, that's an especially dangerous time in terms of the risk of overdose, especially if they go back to the dose that they were using on a regular basis and they don't realize that they no longer are able to tolerate that same dose safely. So the opioid naive and opioid tolerant dichotomy is very important when looking at opioid related cases, whether it be a medical malpractice case and seeing what dose a patient was started on, or the combination of drugs that the person was on, in conjunction with the opioids, or if it's somebody who's using an illicit opioid, and if they have a history of not using an opioid because they're in a treatment recovery program, and then the death is related to even a smaller dose of opioids than they had been using in the past. The other area of interest regarding opioids to attorneys is when they get toxicology testing results. And there are, of course, toxicology screens and toxicology confirmatory tests. Now, toxicology screens are only looking for structural similarities between drugs, and confirmatory tests are actually looking for the molecular fingerprint of the drug. Therefore, there can be false positives with a toxicology screening test, but not a confirmatory test. And I get into more of the details about that in my Toxicology 101 or Toxicology Pearl CLE program, because there's some nuances to really figuring out what kind of test is being performed. And the reason I mentioned a few minutes ago about the fact that there's opiates and there's opioids, the reason why the difference between the two can be important is when you're looking at drug screen results. If the drug screen or drug test is only looking for opiates, then it's not going to pick up an opioid. So in other words, an opiate is a drug that's naturally derived from the opium poppy plant, like morphine or codeine. So therefore, an opiate test is only going to pick up those. Sometimes it'll pick up heroin because heroin is semi-synthetic, so it's partially man-made and then partially naturally derived. So sometimes it can pick up heroin, but truly heroin is not 100% an opiate. And then if it's a screen that is, or a test that's picking up opioids, well then it's looking for things like oxycodone or hydrocodone. So you really have to know what the test is able to pick up before we make any conclusions about what the results mean. Thank you for watching today's video, and I hope you'll join me again for future toxicology topics for attorneys.